Good evening. I am Dr. William Duke from Jefferson City, Missouri. I am a part of the Jefferson City Medical Group, and I am excited to be here with you today to talk about the Lapiplasty 3D bunion correction system and some common questions we get about insurance coverage regarding this system. Before I dive in, I really want to share this important disclaimer with you though. As with any medical treatment, there are potential risks with surgery, and recovery takes time. Potential risks include, but are not limited to, infection, pain, discomfort from the presence of the implant, loosening of the implant, and loss of correction with non-union or malunion. Now that we have that out of the way, let's talk about the Lapiplasty 3D bunion correction system and how insurance sometimes makes us ask a bunch of questions. A bunion is a progressive dislocation of your big toe joint. The big toe starts to lean more and more towards your little toe, and eventually you develop this knot of bone right on the side of your big toe joint. That knot of bone gets painful. It limits you and your activity level and sometimes keeps you from doing the things that you love to do. So why do I choose the Lapiplasty procedure, and why do I think it's right for my patients? Well, a bunion is a structural problem. It needs a structural solution. And there are countless numbers of non-surgical care that you can try. But the truth is, at some point, that structural problem needs to be addressed. The Lapiplasty 3D bunion correction system allows me to restore and realign the foot to its normal anatomical position. When you do this, range of motion should improve, and your ability to get back to the things you love should happen. Now, of course, we have to put you in one of those big, ugly black boots afterwards, and recovery does take time, as the disclaimer stated. But for me, you could be walking very soon, and I have extreme confidence that you'll get back to the things that you love to do. With that being said, let's start to cover some of your common questions that we get regarding insurance and insurance coverage. I get asked often, is this procedure covered by private insurance? Is it covered by Medicare? What about Medicaid? What if I don't have insurance? How much is this procedure going to cost me? Well, some good news. Most private insurers and Medicare do typically cover the bunionectomy and joint fusion procedure that's required utilizing the Lapiplasty system. When these procedures are medically necessary, as a result of, in my opinion, pain, decreased ability to function, and the overall deformity itself, insurance companies recognize this problem and typically do cover the procedure. If your doctor determines that this is the best procedure for you and that the Lapiplasty system is the best procedure and the course of action, which that's what I choose, he or she and their staff can reach out to your insurance company and determine your specific level of coverage. And they can communicate that back to you in full transparency. This process is really best left to your doctor's office. What I tell my patients all the time is, you want me focusing on taking care of your foot, not talking to your insurance company. So in my office, we have dedicated staff that will reach out with the necessary information, that is the codes and the terminology, so that they can determine if this procedure is covered for you. Again, that is best left to your doctor's office and their staff. If you were to do this yourself, it may become very confusing and time-consuming. Trust me, I've been there myself, and I've had patients who have tried to accomplish this, and it usually works best if we do it for you. I also get a lot of questions about Medicaid, and is it covered by Medicaid? I urge you to check with your provider and your physician. Your physician and their staff can reach out to your Medicaid insurance and check your coverage, benefits, and availability. When it comes to private insurance, again, the process is very similar. We have to reach out to your insurance with specific codes and terminology to determine if the bunionectomy and joint fusion procedures that utilize the Lapiplasty system and to ensure that they're medically necessary in the eyes of your insurance. Because insurance plans vary based on individual plans and contracts with specific institutions, I really can't tell you if your specific plan has a specific coverage. Again, that's not something that you want us to do as surgeons, but I can tell you our staff is very, very good at this. They're very good at communicating with your insurance. They're very good at providing them the necessary information to get you the best and most accurate answer possible. Work with your surgeon and their staff. They're there to help you. They're there to make the process as easy as possible. They're there to give you the information that you need so that you can focus on doing one thing, recovering and getting back to the things that you love to do. If you need to know what insurance is accepted, your insurance may have some tools that you can use. A lot of times you can go on their website and see if your surgeon is in that plan itself. You can then go to www.lapiplasty.com/doctor. Look on there for a list of trained Lapiplasty surgeons. Again, I'm in Jeff City, Missouri. Just a joke, sorry. And you could cross-reference those two lists and determine if your surgeon can help you with this procedure and is covered not only under your insurance, but is also trained to do the procedure. Another common question I get is, well, what if I don't have insurance, doc? What do we do then? The truth is there's a lot of people involved in the procedure, not just the surgeon. The surgery center or hospital, the anesthesiologist, and many others are involved. Your office staff, your doctor's office staff, can reach out to all those involved and try and estimate a cost for you. This is going to vary by institution. This is going to be based on a lot of factors. There may be other procedures occurring at the same time. Maybe you need a hammer toe corrected, or maybe there's arthritis somewhere else, or any of a number of things that could be going on. So again, there's a number of factors that affect this total number that you're searching for, but I promise you your doctor's office staff can work with those involved to get you the answer that you need. I've often been told by patients that they were informed by their insurance that the procedure itself isn't covered. I would urge you to do this. Let your doctor and their staff discuss what procedure is best for you, and then reach out to your insurance specifically with the appropriate codes and terminology. Simply calling your insurance yourself and asking if the Lapiplasty 3D bunion correction system is covered probably won't give you the answer that you are looking for. Give us the opportunity to check that for you. I think you'd be surprised with the answer. Another common question is, do I need a referral from my primary care physician? Well, the answer is maybe. Some insurance plans still require referrals, and it's best to discuss that with your primary care physician, who likely already knows the answer to yes or no if you need that referral, and with your surgeon's office as well. They can also help facilitate getting the referral and getting you the appointment that you need. In closing, I would like to say that we continue to live with some uncertainty as it relates to COVID-19. For the most part, and I know for myself, surgery is back in full swing. If you live in an area where things are still pretty rough, I hope that it gets better for you soon. But please know this as well. You don't have to continue to suffer with this problem. There are telemedicine visits and telehealth visits where you can consult with a physician or surgeon who can help you at least get on track so that when things do get back to normal, you can get your foot taken care of. If I didn't get to your question, I apologize, but don't worry. We'll be going through the questions that we didn't answer and responding on Facebook. Thank you for joining me. God bless and have a great night.